Great to be here and invited. That's a 20-year plan by RWJ with all their resources is a little bit of a hard act to follow, but I'll try to share a sort of a local boy's experience with metrics, and really I'm gonna talk about a few things. I'm going to talk about sort of a prototype of sort of a interdisciplinary intersectoral metric set that we developed in San Francisco, how that spread to other agencies in the Bay Area, and then how HUD basically tried to replicate that approach nationally, and that's ongoing work and some insights from that work. And I'll start with just a few thoughts about metrics that I think really need to be there at the beginning. The sort of why, the why metric, why metrics, and what is it that we're trying to do with metrics and their purpose. And I really felt that in Alonzo's presentation and the metrics that were coming out, that I think you'll see that what I'm proposing as kind of sort of design criteria that I think they've been very sort of thoughtful on. So I feel humbled to be aligned with that. So why do we have indicators or metrics? I'll use the term indicators to communicate needs and problems. And also to communicate problem frames. Why is a problem a problem? What's its causes? And the indicator you use communicates that problem. And we're, I think, trying to have a shift from measuring, trying to change the understanding of health as sort of something that's in one's individual control to something that's in individual and collective control, and that's a frame shift. So the indicators you use communicate that frame shift, and I think we saw some examples of that in the indicators that RWJ has proposed. So second, we have indicators as a means to measure progress towards the world that we want. Okay, it's our yardstick, it's our benchmark. If we don't have that, and so that's kind of a fundamental purpose, and so I'm presenting these purposes because I think a good indicator has to fulfill sort of these purposes, and it has to be designed sort of from the get-go to sort of fulfill the purposes. So I think getting to the sort of the intersectoral component is indicators drive instructions for rules, policies, laws, and institutions. And if you look at good rules and policies, they're chock full of indicators. Ones that work, they have, and we'll see some sort of examples of that. And indicators finally help communities, all of us, hold responsible parties accountable. You didn't do your job, but you didn't do your job, and here's the evidence. And I think those are two different things. And if we are going to hold people accountable, other sectors, and in a way other sectors accountable for not considering and acting on health in their decision making, we're going to need some indicators that everyone feels credible, both sides feel credible as evidence to do that. So my first experience with indicators came in my work in San Francisco, and the context was not, it wasn't that, hey, let's come up with some indicators and then do something with it. We were immersed in a problem, which was San Francisco was having a growth boom, and communities were saying this growth is not for us. You're not building the community resources. We're being displaced. You're not building housing where community resources are. You're building at where they're not. You're increasing pollution and noise. Who is this development for anyway? And that led to our effort to bring together something that I think that we didn't need to do in the health department, but planning could have done, or the city could have done, but we did it, was to bring together people and say, what does healthy growth look like, and how do we know it? And indicators. We didn't come to this process thinking that we were going to develop an indicator set, but what people, and at the first few meetings, what people did was draw their vision of healthy communities. And I think that, you see in this vision the culture of health. This is the culture, this is a trademarked picture called the culture of health, by the way. from 2004, just by the way. So people said, okay, so how do we know when we get there? Okay, this is a great picture. We're going to go take this picture around and compare the world to this picture. So people realized, this group realized they needed a set of measures to know, to sort of measure the elements in here and to know whether we were making progress in sort of getting there. So they wanted this yardstick. And so our building an indicator system really came from a community demand to build a yardstick to measure healthy development and to help communities hold planning and other city agencies accountable for healthy development. And I think that was key because there was a group of 40 community organizations that wanted this and was committed to using it. And there was a clear target for action and a clear purpose at the outset. And that was, I think, so essential to the success. So we developed this Sustainable Communities Index, and this was mostly local data, not nationally replicable, neighborhood scale measures, 90 measures for everybody, right? We were not very exclusive. We were not parsimonious. We didn't do that. I agree with parsimony, but we couldn't say no. And so how were these measures used? So there was a target, which was the city's growth plans. And so these measures were used to analyze whether the city's growth plans addressed the problems that the indicators were illustrating. And the indicators, and so what you see here is a map of, and so red is bad, green is better, yellow is better, green is good, for measures of recreational access, quality educational access, and public transit. Now, the development was going to happen basically here in an area, the south of Market in San Francisco, that was excellent on transit domains, but poor on housing and affordable housing, recreational access, and school domains. So this data and the plans, the existing plans, didn't have actions or resources to address these issues. So this became fundamental evidence that justified a number of actions, including a development impact fee that went to a community resource fund, an increase in the affordable housing set aside, a variety of sort of actions that were built in and baked into the policies and plans for growth and development in San Francisco. And that's sort of a short take on it. And I can go now. Not every measure. There were 90 measures. It turns out about 10 were useful or important for that application. That 10 actually moved the needle on things, and that was again very local and context specific. But in the land use and planning domain, these indicators served these instrumental functions. And there were numerical targets for planning policy, thresholds for action on environmental land use regulations. In one case, we used an existing, I think the novelty was we didn't create a new indicator, we used an existing indicator, which was the federal PM 2.5 measure. What we did that was novel is we collected it at a street level scale. We modeled it at a street level scale, and then we applied the same federal standard with data, with the same indicator, but hyperlocal data. We were able to justify impact fees, change the targeting of infrastructure funding, and this was all used for advocacy, and there was a community engine of power behind this that had ownership of this, that had clear kind of purpose in mind when these measures were being developed. So these were, I think, I've got don't have to turn. These are some of the lessons that came out from, these are some of the lessons that came out from when measures were successful. And I think these are generalizable lessons. They reflected community needs and priorities. These were selected and chosen by a group of community stakeholders for their use. They were measured at a human scale. People don't relate to averages. And they don't relate to the, that's not me, I'm not the average. And I think that's a particularly important fact, not only in making the shift from kind of a higher level of aggregation of measures to local or neighborhood level measures, but also I think we need to pay attention to what's happening with data in general. It's becoming hyper-personalized. And if you can know everything about yourself on your mobile device and live in, basically be in your own little bubble, you're going to even care less about sort of aggregate measures. And I think we need to pay attention to how people in society are relating to data today and what data they're paying attention to and what the scale of data is. And I think it's even going to be finer grained than what we did. That we documented unequal conditions. Things moved more when we were documenting a environmental injustice, whether there was a harm that was disproportionate, and particularly if it happened to children, right? Versus when we were documenting unequal access to a good. And that's a bit of a lesson. Measures were successful when they came with responsive actions. We didn't lead with the indicator, we led with the action, and then the indicator was our evidence of problem and our way to either implement the action or measure success. And finally, they were successful when we could integrate them in institutional rules. So I think from there was also sort of a shift for us in, okay, if we're going to use indicators, maybe the whole 90, right, having the set of 90 or even a smaller set of 30 or 10 isn't the right way to go, is that we design an indicator for a particular problem and a particular problem solution set. And I think that's, and this is an example of that, is San Francisco has one of the highest rates of pedestrian injury in the country, and it's because we both have walkers and drivers, and a lot of them, and we have streets designed for cars. And the frame of the problem in San Francisco was this was a behavioral problem, it was bad drivers and bad walkers, and not a traffic engineering problem. So there was traffic calming solutions, there was police enforcement, but it wasn't happening where the injuries were happening and where they were the most severe. So we created a measure specifically to address the frame problem, the problem of the frame, and to shift attention from to high-density busy streets as the source of the problem and where the action should happen. And this measure was basically the linear density of severe injuries on a road. So the severe injuries per mile. This measure showed that 5% of the streets were responsible for 55% of the severe and fatal injuries, and it shifted the attention. It shifted where police resources went. It shifted where traffic calming resources went. It made transportation realize they need a arterial traffic calming toolkit, not just a residential traffic calming toolkit. So it was highly effective, because I think it was really designed for purpose and designed with the barriers to change in mind. And again, I hear a lot of that in Alonzo's presentation. So shifting, I think, to a regional level, I was part of a process at the Regional Transportation Agency that used that integrated health and neighborhood and sort of community well-being indicators into their process. So what do regional transportation agencies get a lot of money from the federal government to historically build highways, but those monies are now going into investments in transit and walking and bicycle facilities. So highly relevant. It's also relevant to development of housing. If you don't invest in transportation infrastructure, you can't have the other neighborhood infrastructure, so it's kind of a linchpin sort of funding source. So without getting into the details, the Bay Area Transportation Agency wanted to broaden their way of evaluating how they're spending that money from just how fast are people getting to work to a broader set of livability measures, and we were able to integrate 3 or 4 health measures into that set. And we were able to design and integrate a set of equity measures into that set. And I'm not going to get into the details. This that set of measures was used in project evaluation and selection. So every project was weighted, was evaluated both on how much it moved the needle on all of the indicators and what its economic cost-benefit ratio was. And there were some problems with this because some of the health benefits weren't costable, so they weren't included in the cost-benefit analysis, but all of the projects that were evaluated against the health measures. So this is an example of bringing these indicators in a very purposeful way into institutional rules that are allocating funding. Again, a big problem here was that 85% of the money, of the billions of dollars the transportation agency was getting, was already spoken for by committed legacy projects. About 15% was discretionary. But of that 15%, this metric set, which included, I think, a number of these neighborhood health and well-being measures, was actually used to in the project sort of selection process. So finally, I'm going to, I think, talk about some work and some lessons, some early lessons from the Healthy Communities Index. And this is a project sponsored by the Housing and Urban Development, and it was sponsored by an office, the Office of Lead Poisoning Prevention and Healthy Housing in HUD. It was done specifically to respond to the need for a comprehensive and uniform practice for monitoring neighborhood level determinants of health. And they wanted to get to the measures at the neighborhood level. They also wanted uniformity. What measures can we get and getting beyond just sort of the usual suspects that we can get from the American Community Survey or other sources like that. So this began in 2012. There were 4 indicator selection criteria. One isn't showing up for a reason here. So the first criteria was that there was an established evidence-based nexus to health. Second, it was measurable at the neighborhood scale, which meant either that somebody had already collected the data for every neighborhood in the country, like the ACS, or the EPA has a smart location database that's a block group data set, or we believed that, and this is where some of the innovative measures were, that local data could be processed uniformly to construct neighborhood level indicators. Third, they were actions to improve the indicators, that these were not, and those actions were generally in control of local communities. And fourth, that these were relevant to community needs and priorities, and that's not showing up on the slide. So, this is where it is. So there were 220 indicators reviewed. There was a group of domain experts identified to provide review of the measures against the criteria. And 90 went into sort of a final review process. There was a national advisory panel that provided comment on the proposed final set, and then HUD finally selected 37 core indicators and 5 indicators that were more city level and not neighborhood level considered contextual measures. They were, and I'm not going to spend a lot of time on this because I think between Steve, I think with Steve's presentation, what you're seeing is, these are the, these were the domains, but what you're seeing is a lot of conservation among the projects, in these various projects among these domains. These are domains of well-being, they're domains of livability, they're domains of sustainability, they're domains of health. Any one of these sectors, I think, they're domains of planning. Any one of these sectors, I think, can claim those domains. This project is now in kind of a pilot stage. 4 cities, Minneapolis, San Diego, Providence, and Albuquerque, have collected the measures, ranked every neighborhood on the 37 measures, and put up these websites, and are now kind of in a process of sort of stakeholder engagement to use them. Some lessons from this project, and some good lessons and some, I think, not so good lessons, well, they're all good lessons. One is that we had proposed some measures like chronic school absence that would require coordination, collaboration from multiple school districts in an agency. But it was a very simple measure and we believe very feasible to sort of achieve. And yes, we're sort of able to find a uniform definition of a neighborhood, of a human scale measure, and collect it in multiple cities. And I think that was an innovation. But there's a landscape of competing indicator projects, and that's confusing people. Why are we doing this? What's the added value of this? Engagement happened in our work in San Francisco. Engagement happened first. In this work, we're coming with a top-down set of measures, and engagement is happening later. And engagement is positive, but people are going to need time to get their head around it, own it, change it, and mix it up. They're not going to accept these measures as the ones that they need to solve their problems. And I think that's sort of an important lesson. And finally, I think we're struggling here at the kind of the end of the project is that this was supposed to lead to a few applications, that people were supposed to use it for the kinds of changes that I was describing in San Francisco. But again, because the data has come first, it's not kind of a problem-first problem-solving exercise. It's a little bit of a sort of a project and a solution in search of a problem. And the indicators are searching for applications, and we may overcome that, but I think it's a lesson. So indicators, just a final couple of points. Indicators don't necessarily mean progress. We have the GDP, which is an indicator that has an army behind it, right? An army of economists and Wall Street and everyone behind it. It's got a big engine behind it. And then you have the genuine progress indicator. Do people know the genuine progress indicator? It was created by Redefining Progress, I think in the 70s or 80s, and it was a more holistic measure of sort of well-being, and needle hasn't really moved on it, right? There isn't an engine, really much of an engine behind that indicator. And I want to sort of, share. I know in some ways kind of getting out of where we are and, what do effective indicators, I've got two prototypes for indicators that are highly effective, right? One is a speedometer, right? There's an engine behind it, there's a pedal that you change the output of the engine, there's a brake, you look at the, you as a human is sort of using it. It's part of a system. And there are the controls, and it works. And I think similar to sort of blood pressure, right? Although there's more people involved in the blood pressure monitoring system. But while these may seem like strange examples, these are working indicators. And I think we need to think about working indicators and what are the properties of working indicators, and then and really sort of shift. I think from what I think business as usual is data first, and I think that success is purpose first. What are we trying to do? What does the indicator look like that is going to achieve what we are trying to do? And I think through some of those lessons, it's almost like you design the indicator for a purpose, and maybe somewhat opposed to a movement to come up with sort of a uniform set of parsimonious indicators just for argument. What if we had a app that designed the best indicator for your purpose, right? So data is becoming hyper-personalized, hyper-localized. Is that a bad thing in some ways? Yeah, if we collected cholesterol in 1,000 different ways, we probably wouldn't have very good therapies for cholesterol, or we might not. But there's advantages in the other, and I think we just need to be mindful of that. So with that, I'll stop. Thank you.